So, but the point for me is that endocrine disruptors are one more factor in the scenario there that make you more predisposed to be obese.
Yeah.
How that can happen? We need to imagine that we are normally exposed to a cocktail of endocrine disruptors, not only to one of them, not only to bisphenol A. If you are only exposed to bisphenol A and it's, for instance, affecting your food intake rate, probably you're going to adapt, and then you're going to have less storage.
It's easy for the body to adapt to
easy for the body to adapt.
Yeah.
But we are exposed to about 40, 50 at least different chemicals that have been measured in our blood. And they affect every term in the energy balance equation, which is energy storage rate equals energy intake rate minus energy output rate. Okay? So we know that endocrine disruptors are going to affect energy intake by affecting our hypothalamus. They know that some of them affect the levels of expression of MC4 receptors, for instance, in the hypothalamus. We know that they may affect absorption in the intestine. They affect our microbiota that also, can be involved in controlling our food intake and satiety. And at the same time, we know that other chemical DDT is one good example, can affect energy output by affecting thermogenesis in the brown adipose tissue. We know that many of these chemicals affect thyroid hormone action, and thyroid hormone has, of course, a good relation, an important relation with metabolism.
Yeah.
And what has been most studied is the effect in energy storage, how some of these chemicals affect the adipocytes, and they affect adipogenesis and affect lipogenesis as well through nuclear receptors and other mechanisms, and promote energy storage. And at the same time, as we have been talking about, these chemicals change insulin levels, they change leptin levels, they change adiponectin levels, interleukin levels as well. And, it's a whole cocktail of effects disrupting every term and every tissue involved in energy balance equation.